The entire contents of this podcast and website are based upon the opinions of Tammy Garcia and her guests, unless otherwise noted. The information on this podcast is not intended to replace a one-on-one relationship with a qualified healthcare professional and is not intended as medical advice. It is intended as a sharing of knowledge and information from the research and experience of Tammy Garcia and her guests. This is the Naturally Inspired Podcast, coming to you from our 1890 homestead in Johnstown, Colorado. I'm Tammy, and I want to thank you for joining us. Let's get started and help people feel good so they can do what they love for longer. Today on the Naturally Inspired Podcast, Dr. Jacqueline Bearden is joining us. Dr. Bearden is a board-certified medical physician. She has done extensive training in cosmetic procedures and the anti-aging field. Today, we are going to learn what we can do to age gracefully. Welcome, Dr. Jacqueline Bearden, to the Naturally Inspired Podcast. I just want to welcome you to the Naturally Inspired Podcast, and thank you again so much for being here today.
I'm happy to be here.
Yeah, we're going to dive into some stuff that like I said, people want to know about, but maybe are afraid to ask. Mm-hmm. But first, I would love for our audience to get to know you a little bit. So can you tell us a little bit about yourself? Where were you born?
Yeah, I was actually born in Greeley, Colorado.
What? A native of Greeley?
I am a native of Greeley. Well, I actually grew up in Windsor.
Okay.
But the hospital I was born at was the Greeley Hospital here, but grew up most of my life in Windsor. I spent a few years in Oklahoma when my dad was a veterinarian.
Okay.
And he went back to farming. And so I grew up very rural in Windsor when it was a very small town. So
interesting. And it's grown so much since then, I bet.
Yeah. And then, immensely. It's not even this. I think it was only about 1,000 people when I was there. So it's very much a different town, as is. You're in Milliken or Johnstown?
Johnstown.
Yeah, Johnstown's grown, which has changed a lot too. We used to always play you in sports, but I don't think so anymore. I don't think we're the same league, but yes. So I actually do that. I mean, my husband, then after I graduated medical school, we lived different places and driving around. We came back to this area probably about 20 years ago.
Okay. Yeah. So you really are a native, and this is where your roots are.
Yep.
Yeah. Did you grow up on a farm then? You mentioned, yeah. Okay. So tell me a little bit about that. How did your interest in medicine? You mentioned your dad was a vet.
Yeah. Actually, I'm not one of those people that knew they wanted to be a doctor from the time that they were young. I actually started out thinking I wanted to go into education. I didn't know what I wanted to do.
Do we ever? We're young like
no.
We're supposed to know.
I know. So I ended up starting out at UNC in education, and thank God that they put me in a classroom with small children. And I realized that this was not my gifting at all. So I thought, I'm going to be in prison probably. And it was my love of chemistry, of all things, that drove me on. And then I thought initially I was going to do something more lab related and went into microbiology in that area. Then I soon discovered that I hated working in labs. It was boring,
Right.
I liked change and everything. And we all are on life journeys, and this may really shock you, but people kept telling me you should be a doctor. And I looked at them and I'm going, first of all, I did not like school. I just didn't like the effort.
Yeah.
It was a lot of work, and I'm not going to be in school that long. And I kept saying no. And I had even random people come up to me and say, you should be a doctor. You would make a great doctor. And I finally said, God, are you trying to give me a message here about where I'm supposed to be going? And so I applied. My advisor said, you probably won't make it the first year because it's hard.
That's nice.
My grades were good, but she knows the competitiveness of it.
Oh, okay. I see. Yeah.
And I said, well, what will be. And I got in my first year. So then I ended up
Wow.
in medicine. Just kind of, it was just like one of those weaving paths of figuring
Right.
life out. So,
I had a doctor on last week, Dr. James Rouse, and he was talking about pollinating people. And it's interesting that your story is one where which people pollinated you
right.
in that direction. You know, just having their. Sometimes we don't have the belief in ourselves,
Right.
but when someone else says, "Hey, you should be a doctor," then it just, huh? You know, you hadn't thought of that, but they
No,
were pollinating you.
that's a really interesting way of putting it. But so often we don't realize the power of our words to speak into people's lives. And,
Absolutely.
I think that is very critical that we can all do that, no matter what profession that we are in, just to point out the value you see in someone so that they
Yes.
sense that appreciation of who they are,
Yeah.
their value.
Yeah.
Yeah,
Yeah. They're really encouraged. You can be really encouraged, and you have no idea, like you said, the power of your words on someone.
right, right.
Very incredible.
Yeah. Also,
So,
how the negative words could also be very detrimental too.
yes, and
Yeah.
that's unfortunate because the human mind tends to remember the negative stuff a lot easier than the positive things.
Yeah.
So, and I find, you can find something positive in anybody.
Right.
Really, really can. If you
Right.
take the time and listen
Yes.
to people, you can give them a genuine compliment because you can see the
Mhm.
strength if you pay
Yeah.
attention.
Agree.
So tell us a little more about how then it evolved for you into what you do today.
Yeah, that's another one of those little
Is it?
stories. So I have 4 children, and so
Okay.
I always worked part time. I went initially in family medicine. I
Uh-huh.
went family medicine because that's all the medicine I ever really knew. Because my family was fairly healthy, and so it was just the family doc, and I
Right.
like the relational aspect of thinking of families. So I went into family medicine, but always worked part time. And then when we moved back to Greeley, um, about 20 years ago or so, it was just a kind of a difficult season. My
Okay.
kids were finally in high school. My husband, because of his work, he does a lot of contract work.
Mhm.
He was out of a job, and I was diagnosed with multiple sclerosis. And
Oh my goodness.
yeah, and it was like, okay, we needed financially a little bit more help, but I did not want to work a real strenuous,
Right.
increase my load. And
Mhm.
I heard about laser hair removal, and I became fascinated because I do like procedural things. I think
Right.
it's an inner part of me that wishes I was a surgeon, but um, and so I just became fascinated by it, and it evolved that one of my partners at that time, his wife was at home raising kids, was also a family doc, and she got whiff that I was interested in this, and she knew about all things Botox. I had no clue because I was
Right.
very much a pretty simple country girl.
Right.
I
Right.
never had a facial in my life, never walked in a spa, I don't think, ever. And she said, we should learn how to do all of this. And it just kind of evolved then from there. So that's how,
Oh, how interesting.
yeah, it wasn't like, oh, I'm getting old and how can I fix myself? So,
Right.
uh,
How
but
can
that
I?
was, 15, 16 years ago. So we
Okay.
started that journey. So I was a little younger then, and but now very much so. I'm very keen on how to myself a little older. So
Right,
yeah,
right. So tell us what you do today then. So you work in a restoration clinic.
yeah,
What's the name of your clinic?
right. And when we named that clinic, it was like, okay, what do we want our name to be? And we wanted people to know that we were medical, but also that we were in the what they call the Medi Spa business.
Right.
But also, we wanted to speak about something a little bit beyond just the outward, but the inward too. Because so much, I
Yeah.
think, of your outward appearance is how you feel about yourself inside
Yes.
too, as well. And I think restoration kind of spoke that word. So, hence that name. what we do is mostly things that on the outside looks very superficial. We do the Botox, the fillers. We have a sundry of lasers, radio frequency devices, things to help anti-age, help to make you feel more confident about yourself,
Right.
that sort of thing. Um, I do have a few ladies in the back who do nails and massage and stuff, but they're kind of independent. They're
Yeah.
actually just good friends that I lease some space out to, because
Right.
it's just kind of a family there.
That's
So
wonderful. And
yeah,
it's a place to come to feel, just to fill you up, so to speak.
exactly. We got a little bit then into, we do some bioidentical hormones. We started that just a few years ago, doing what they call pellet therapy. And
Yeah.
we do a few supplements, but I keep it pretty narrow, the focus.
Mhm.
Just, our motto is look well, live well, feel well. And I think we just want people overall to get a sense of wellness.
Yeah. Yeah. I
But
love
I'm not
that.
extreme with the functional medicine. There's a lot of information out there that's almost overwhelming. But so we do a little bit of dabbling into that. So
That's wonderful.
uh-huh.
So I want to get into kind of the nuts and bolts of what happens when we age. Because, we're all going through it every year. It gets a little more different. And I find particularly with women, a lot of this stuff is a surprise. I
Yeah.
don't know how it becomes a surprise to us because clearly we're around our mothers and our grandmothers and there's older people around us all the time. But when it happens to us, we're shocked.
Yeah.
What's I don't know why, but we are. And so what happens to cause our skin to droop and sag and crepe and wrinkle?
Well, there's a lot of different things. The basic thing is we start to lose collagen. Collagen is kind of like the building blocks of underneath our skin. Elastin is the stretchy part, the spring back
Okay.
of our skin. Interesting too, we tend to, we have these things in our face called fat pads,
Huh.
and they're like what give us our youthfulness, and they're located in strategic areas to kind of give us um, that full and supported face look. And as we age, those actually shrink and sink and
Ah.
fall. The other thing that happens too is we actually lose bone structure. It's quite fascinating. You see a skeleton that's young versus aged, like the eye sockets become bigger, the jaws actually become smaller and narrower. So again, we're losing the structural support,
Okay.
losing the elasticity and the skin itself building blocks. And so we sag and it falls and it sinks. So
Oh, interesting. I didn't realize we actually like lost bone.
yeah, I know. Yeah, and that's why, well, so often our sockets get kind of hollow. We
Right.
sink in and get those deep hollows to our skin. And yeah, and it's quite fascinating to see pictures of skeletons and how people age. So
Right. Well, I definitely noticed, and this is kind of a funny comparison, but um, are you familiar with Friends, the show Friends?
yes, at my age, I should have been the total fan and watched it all the time. I was just talking to my daughter-in-law about it. Like, I didn't watch it that much. And it was like everybody my age watched Friends.
Yeah.
But
But
anyway,
I think they're such a great example because they often show the side by side photos of them and now, and it's not that it's hard to put your finger on it, but you can definitely see how they've changed and their faces have become a lot slimmer.
mhm, yeah,
In almost all of them. That's one thing I really noticed. It's like you can see when they first started how round their faces were. And then near the end of the season, you really saw the slimming of their faces. They still look fabulous, but their faces are so much slimmer. And it's not that they've lost weight.
right, right.
So
And
that would be the fat pads you were talking about.
yeah, yeah, they shrink and sink. So yeah, and also that lack of that bone structure too as well. That's why heavier women tend to look more youthful because they have
Right.
more fat in their skin. And so it's the one time losing weight doesn't help is oftentimes in our appearance of our face.
Right. Right. A little fat in your face is definitely a good thing.
Right, right.
Yeah. So is there a difference as far as like fairness of your skin goes, or is it really just structural? Like it doesn't matter if you have darker skin or lighter skin?
Oh, there's definitely a genetic component to it because there are just some people that just age faster. People
Right.
with naturally thin skin,
Hmm.
tend to age and wrinkle so much
Is
quicker.
thin skin, is that fair skin?
Yeah,
Okay.
sometimes it can be, but yeah, but especially like Northern European women tend to definitely do it. Asians and people with African heritage, they tend to keep their skin looks so much better as they age.
Right.
They just have a thicker skin texture. So it definitely makes a difference, your genetics, but even just family, you can oftentimes look at one of your parents and know you're probably going to age similar to them,
Right.
not taking into account like if they were smokers or
Right.
they
Environmental.
environmental things, so you can counteract that. But a lot of times it's funny, even you get the creases in your brows and
Yes.
just you'll mimic your parents so often. And I oftentimes wonder, is that just a learned behavior, how to
Right.
bow and use your facial muscles, or is it something genetic in what we do?
Right.
So
Oh, I totally can relate to that because I see the same lines on my face that my mom had.
uh
And also maybe it's mannerisms too, because I see mannerisms of my mom in my daughter.
oh yeah.
So maybe it's the way we're using our face
Hmm.
is all similar.
Yeah,
Very interesting.
yeah.
Very interesting. Okay, so now that's the bad news, right? We're all aging, we're all
Right.
wrinkling and creping and getting older. What can we do? What are some natural things that we can do to prevent aging in our skin?
Um, well, first of all, what environmental factors can you avoid doing? I mean, smoking is so horrendously bad on your skin,
Right.
sun is actually really bad. Now, the sun has so much benefits. We know vitamin D and bone structure is really important. So we don't want that bone loss or that osteoporosis thinning of the blood.
Right.
And so, it has some benefit, but to the face directly, probably the number one aging thing to our face is the sun. So using sun protection, wearing a hat when you're out in the sun, those sorts of things that you can do. Nutrition, I think, is really important. I think, fad diets are just bad.
Yeah.
Low fat, low carb, low this, like that. I think to eat a wide balance of good fats and high potency fruits and vegetables that have all those antioxidants and
Hmm.
nutritional things, we can kind of do to help. And then there are certain things, and then we can now know we can do to help stimulate things like collagen and elastin formation, um, somewhat through diet, but also through some of the procedures. And then if all else fails, we just start putting stuff in there. So plump it up, let's add a little volume, how we use our face, the movements we make.
Right.
Smiles give us those cute little crow's feet, but when they start striping down our face. So that's how, Botox can help kind of stop some of those movement lines that kind of age our face too, that start to creases in. So, yeah.
Right.
Yeah.
Now, what about like the creams and I've seen recently, I think I saw on Facebook ad, somebody had invented like an exercise thing for your face.
you know, uh, you mentioned that we might be talking about that, and I was thinking, I don't know. So I tried to do a little research on that, and what I did find is that there might be some benefit for exercise, but they say you have to do it like 30 minutes a day. Now, I don't know who's
Wow.
there 30
Just on
minutes
your
a day
face.
on your face and exercise. It's hard enough to get to the gym for 30 minutes.
Yeah.
Now, I'm going to sit here and move it because, you think, okay, well, if I stimulate my muscles,
Yeah.
that I'm going to, develop some sort of thickening, or increased volume by having more muscle. So I suppose to a certain degree, you can. It's real interesting. I have a textbook of very early medicine and what they recommended for women.
Uh-huh.
to help anti-age their skin. And a lot of it was doing things like they had them strike their face with leaves or slapping or pinching their face,
Okay.
you know. And to a certain degree, that's true because we do know that any sort of physical trauma to the skin actually helps with stimulating a little bit of collagen. So
Oh,
there's
okay.
probably some benefit, but I don't know if it's worth 30 minutes of your day for the effect that you're going to get.
Right. And sustainability, which is key. I
Yeah.
love that you mentioned the fad diets because, physician after physician that's on this program has, talked about fad diets and just how you're not really doing yourself any good with going on these restrictive diets for short spurts and then going back to a different your regular diet or whatever. It's really about sustainability.
Right. Right.
If you can't sustain it, then it's not going to be a lifestyle for you. And that's what the goal is here is optimum health through lifestyle,
Right.
to really be able to make and implement those changes that you're going to stay with is key.
Mm-hmm.
And 30 minutes a day exercising your face might not be
No. No.
sustainable.
Mhm.
So anyway, I love that you mentioned the fad diets because nutrition is very powerful. And when we're up and down with it all the time, I think sometimes we do more damage than we do good.
Mm-hmm. Great.
Yeah. Um, you, you talk about vitamins a little bit for the skin. What are some vitamins that we could take that would promote good skincare?
Um, you might think of the word ACE, vitamin A, C, and E. Okay.
Okay.
Because we know vitamin A helps, like with acne, but it's kind of an anti-inflammatory for the face. Vitamin C, we know, is part of the building block for collagen, but it's also an antioxidant for the face.
Mm,
We know that free radicals is one of the things that damages and causes increased risk for things like skin cancer, but also it kind of helps to just prevent the damage from sun exposure and toxins in the air and that kind of thing. And vitamin E is a really healthy fat. Omega-3s help. Anytime you promote total body health, you do, because if your thyroid doesn't function right, what happens? Your hair gets
right.
brittle, your skin dries out. And so your minerals like your selenium and iodine, all that helps um, your thyroid to function better. Stress is such a big thing that really can age our face too as well. And there's not necessarily per se a supplement for that, but
Right.
um, there are sometimes some programs out there that help when you're under stress to help build up your body. But
Mm-hmm.
collagen's a real interesting one that I kind of don't quite get totally, but it seems like collagen supplements do seem to help.
Yeah.
Um, but because anytime you ingest something, your body breaks it down, but it's the
Mm-hmm.
building blocks of amino acids. So I think it may just be the proteins that are in there, those building blocks that we need. Again, that's why these really fad diets that just, no protein hardly at all,
Right.
is not good either. And then your healthier fats are so important too.
Yes.
So I think just a good mineral supplementation, um, vitamins, but your antioxidative type vitamins like A and C and E and stuff are just really good. Yeah.
Right. You mentioned stress, and it's interesting because I just did a podcast yesterday with a women's hormonal balance functional medicine specialist, and they really boiled down to that again: stress.
It is.
And so you see a ton of different people, I'm sure, in your clinic, and I'm sure you get a sense of who people have been dealing with extreme stress. How do you offer that up to help people deal with that?
You know, I think it all just depends. But first of all, just it's about self-care sometimes. And I think um, I don't think we're always really good about that in America. There's a certain subset that, maybe overindulge in their selves. But I think just in terms of community and support when you're going through a hard time, we sometimes just deal with it on our own rather than seeking out friends. But what do you do with sleep? Make it a priority,
Right.
just burning the candle at both ends. How do you get rid of worry? You have to find, where can you get your peace from? And I'm a strong believer that your spiritual man is a very important key to that, because people who are at peace have a radiance to them.
Yeah.
And so you have to find that in your journey too, as well as how do you gain that, because it's all intertwined,
Right.
the mind, the body, the soul, the spirit. It's all critical, I think, with your health, as well as your skin and your appearance. So
Right. I
but
love that. I love that you mentioned that because, I think we've all seen that really older lady with the long golden or gray hair, rather, white. And there's just something about her that,
wow,
you just think, wow, she's beautiful. And she
right.
could have wrinkles all over her face.
Yeah, yeah,
And there's just something there that's kind of, coming out of her soul, if you will.
right. Agreed.
So to work on your spiritual sense is such a valuable tool in the way you come off and the way you look as
Right.
well.
Yes. So, but I heard a statistic the other day that the average person, back in the times of Edison, before Edison created the light bulb, got 10 hours of sleep a night was the average.
Really?
Yes, and now it's less than 6. And
Oh my gosh.
it's like, you just wonder, if we all just had more sleep, and
What
what,
that would do.
like,
Yeah.
how different would we be? Of course, then they all died young from
Right.
disease and infection, so they never lived long enough to know, how they would look when they were 80. So
They never hit they were lived to 35 at best.
I don't know. Hopefully I don't have all the answers there, but we just don't support the idea that it's okay to take time to sleep.
Right. It's almost I don't know. I've noticed this for years that to claim how busy you are is like a badge of honor.
Mm-hmm. Right.
Oh, I'm so busy. I'm so busy. And I've really I've tried to take that out of my vocabulary because everything I'm doing today, I love. Even
Right.
though, I do have a lot of things on my calendar, but I do love everything I do.
Yeah.
And so I feel like busy is a negative word.
Mm-hmm.
So if we were a little bit more accepting of rest and not being busy, I think we could all just breathe a little better.
Right. Agree.
What about water intake? We hear a lot about water intake when it comes to our skin and our health.
Sure. I think hydration is good, but I think there's been enough studies showed that really super high water intake, so that sometimes people do for weight loss and every reason. There's
Yeah.
probably not a lot to support that. But I just think staying hydrated is good.
Yeah.
Definitely. It does, especially here because the skin is so dry. It's amazing how much better your skin feels and looks the minute you go to Miami. It's like,
Yeah. That's so true.
wow.
And
Yeah.
your hair.
Moisture out. Oh yeah. Well, there it's frizz, especially if you got curls like me. But so definitely, hydration is good, but all in balance.
Right. Right. So I want to talk about a new procedure that I've heard about, and I know that you do it. So I'm hoping you can shed some light on it. What is this thing called PRP?
PRP is an abbreviation for platelet-rich plasma.
Okay.
And it basically, what it is we draw off, if you draw off your blood and you spin it down, it spins into 3 kind of visible layers. There's the red blood cell layer, there's the white blood cell layer, which actually looks white, and then there's the serum. But right in between the serum and the white blood cell, there's this very small, thin layer that you don't really see that well with the naked eye, and it's concentrated platelets. So
Ah,
what they do is when you spin the blood down, it's packed pretty firm. You can gently reconstitute the platelets back into the serum, and then they draw that off. And it's used for a lot of medical purposes besides in skincare.
yeah. It's really, I mean, I think it's been quite a few years, but recently it seems like it's becoming maybe a little bit more affordable. So we're hearing more about it in in articles and things like that.
Yeah. Yeah, it is. And I think it all, depends on where you go. At first, they thought you had to do this ultra purification, ultra concentration. That got really expensive. They
Yeah.
didn't realize that having it super concentrated actually didn't work as good as less. In this case, more is not better. And so it can be affordable to do. I think it just depends where you go for what reasons. I know it's used for a lot of orthopedic related
Yeah.
issues.
Yep.
And if you look at the research and the data that's out there, it's not 100% saying it's fabulous, but I think I don't want to knock mainstream medicine, but I think sometimes when a drug's not involved in a pharmaceutical company, it just doesn't get researched or studied as much. And
Right.
it's hard to get FDA approval on something that's already in your body. I mean, what can you say about it? Because that's the beauty of it. It's just you.
Yeah. It's
So
you. Yeah.
it's nothing outside. It's nothing chemical. You're just using your own body's natural abilities to heal. Um,
Right.
to
Concentrated.
Yeah, right, exactly. So
Interesting. Interesting. Yeah, I've seen, people that are using it on their knees with pretty good success. And is this the same thing as stem cells?
not quite. No, it's not.
Okay.
It does have some regenerative potential like stem cells do, but it's not the same thing as
Okay.
stem cells. But they're used for very similar things. And in fact, even with skin. So when we use the platelet-rich plasma or the PRP, we inject it into the face, but we also do a procedure called microneedling where we put little tiny holes into the skin and then we massage the PRP into those holes as well. And
Okay.
we find that we get a really nice effect, but some people are starting to use stem cell concentrates. And most of them are very ethically developed. It's interesting that one of your best sources of stem cells is fat. There's
Ah.
more stem cells in your fat than there is in your bone marrow.
Hmm.
Some people get it from your own bone marrow. Some people also have it's manufactured and made a lot of it from umbilical cords or fat.
Interesting.
And it tends to be, though, a lot more expensive. You have to do a lot more quality control especially because if it's coming from outside sources, but you can do your own cells as well. We actually do one where we use your own fat and use it and inject it into the face, and it's beautiful. Just wish
Wow.
it lasted longer for the cost of doing the procedure, but yeah, it's quite interesting because when we think of platelets, we think, oh, well, it clots your blood, but
Yeah.
platelets actually have like 40. It's like different ththings that they do. The body is
Oh,
so
really?
complex. Yeah, but it brings in healing factors. So when you get a wound, it stops the bleeding, but it also brings in different healing factors to heal the wound. It attracts them, and so that's some of the principle of how it works. So yeah.
Interesting. And so
Mhm.
you mentioned it doesn't, what is the time frame that it lasts? You
You
have this procedure done. Do you see results right away?
No,
Okay.
usually we say it's always when you do it with a microneedle, within a couple of weeks, you may notice that your face looks a little bit fresher, but it's about 4 to 6 weeks in when I really see that there's all of a sudden your skin just has a different tone, a different glow to it.
Okay.
It's a little bit more of a fleshy, youthful area. I like to inject it a lot underneath the eyes.
Uh-huh.
Interesting. I also inject it deep into the tear trough, which sounds horribly painful, and and scary, but it really isn't at all. It's one of the few things that I've seen that really helps dark circles for some
Huh,
reason. Maybe it's because it just, stimulates more structure under there. So it can
right,
help the hollowness, and because that area is so difficult to treat, those crepey thinning eyes. So
right. Can you
yeah.
explain a little bit more about how it works? So you have the serum and you inject it, and what is it doing to the skin? Is it just building up
Right,
the
right.
area?
It draws in these healing factors again. And, with the microneedling, it stimulates just new collagen and
New
elastin formation. Yeah.
Okay.
Yeah. And just builds up that structure. It's like a web of building up healing, just like it built up and healed the wound and closed it up. It just built more structure in there. How long it lasts, we tell people, well, the PR people tell us 18 months. I would say, after about a year, you're kind of wishing that you could get a little freshen up again. I think it starts to wear off about then. So,
Okay. And are there things you can do to to preserve it, like stay out of the sun, or, does any of those things really help or not really?
I don't know. I mean, overall, just taking care of yourself,
Right.
it's just like anything else with anti-aging your skin. But I don't know if anything to necessarily per se help that to persist. But yeah.
Okay. And if someone comes in for the procedure, what can they expect?
So usually, because we always do it with microneedling, occasionally I'll inject it. I have some people who just like to come in and get more injected underneath the eyes, try to help the dark circles, but almost we do with microneedling. So we usually have topical numb that they apply 30 to 45 minutes beforehand. We draw their blood, and we spin it down. Usually one tube is adequate for doing a face
Okay.
treatment. Then we'll wash off the face, prep it with a little bit of alcohol. I typically, just for timing, I inject into the problematic areas or the areas where I like to see those dewy changes. So a lot of times I do the cheekbone areas, because a fleshy elevated cheek always looks more youthful, and we
Right.
really hollow in those areas along the jaw lines. Or if I see any problematic areas, or like if people have acne scars, I will inject into the acne scars, because I think it can help with that too as well. The-
Oh, yeah.
um, and then we save some of it, the plasma, and my esthetician usually comes in and does the microneedling procedure, which is not terribly uncomfortable. I think my pokes are probably more uncomfortable than needling. But it's actually under the eyes. It's interesting. It doesn't really hurt hardly at all. Maybe it's because of the tiny needles, or I don't go as deep and as much, but um, they will do the microneedling, and they massage the PRP in. And they have a day of low dryness. They usually can wear a little makeup the next day.
Oh,
So it really
wow.
doesn't have a whole lot of downtime.
Okay.
So that makes it nice. So for so many of us, one of the biggest obstacles to doing a lot of procedures that we do is people just don't have time, because they're so busy, uh,
Yes.
you know, to, to take a day off. They need to be at work the next day, or they have
Right.
an event the next day. So
Right.
yeah.
Well, and also we talked about at the beginning a little bit about just like it's still kind of something that, people aren't proudly displaying,
Right.
like I've done this because of whatever. They feel like it's not acceptable or it's vain or whatever their reasoning is.
Yeah.
So part of it is, how can I get through this quickly where no one's noticed?
Right. Right.
Right.
But
Um,
yeah, there are all those people probably that still judge and
yeah.
criticize for doing that. But
Yeah.
um,
Yeah. Yeah. Get over it.
yeah, that's right. Who cares? And as long as we just say, I don't care what people think. And what's very nice is that you're doing stuff that's all going to be very natural looking. It's going to look like you. It's not
Right.
going to be fake or plastic about it, because it's all you. You're
Right. Right. It's coming from your body.
right. Right.
Yeah. So I was confused then because I have seen in movies and I've seen a couple people in person where they really have like a red um face for quite a long time. And so
Right.
that's not the PRP that does that.
I think the microneedles that you use, and sometimes you see people too where it looks like blood on their face. That's
Yeah.
not properly. You should not have any red blood cells or very few mixed in with your serum. It's actually kind of a clear yellow. And so if
Oh,
you see blood, then that wasn't properly done PRP.
interesting.
Yeah.
Yeah, because I read a little bit about it when I was preparing for this podcast, and it's even called the vampire facial.
Yeah, that's actually a TM'd thing from a doctor down south who TM'd that talk
Procedure or that.
that name of it because it's your own blood, right?
Right, right.
But even he, it's not how it's done. It's actually processed off. We don't use the term because it is a copyrighted TM thing. We don't
Oh,
call
I
it
see.
vampire. We just call it PRP.
Right.
But anyway, yeah. But that term is oftentimes used. The type of microneedle you use too, some can really scuff up your face. So it has to do with the quality of the microneedle too. And
Okay.
typically, sometimes you can get a little bit of a road rash look the next day.
Yeah.
And, so it's not 100%, you don't see anything, but you can typically, we will say a little light mineral makeup just to cover it up so that it can keep you going. And it depends too how aggressive you go with the microneedle. Can maybe make you look a little bit rougher, but we're pretty aggressive, and our gals really don't look too bad the next day. But
Right.
we had 3 different pens for doing the needling, and we keep trying to find the better one. So
Yeah. So
yeah,
you're always kind of trying to get better. You're always expanding and looking for the next best
yeah.
one.
The one thing that you should just be aware of, there was a case of I can't remember if it was hepatitis C or HIV that several people got from a med spa doing microneedling because
Wow.
of appropriate handling of blood. So I encourage you to make sure that the location where you do it has some understanding, knowledge of how you handle blood, because that device has gone, it's used from one person to the next. The needles should never be reused. We always,
Right.
throw it away. You always only use your own blood. I don't think that was the case. Probably their device was contaminated and not adequately cleaned. And so you just need to be aware of that, even though it's pretty safe
Right.
procedure, 'cause it's all you. You just want to make sure they know it's a facility that has some medical supervision. It's not to say that an esthetician can't be doing the microneedling,
Oh,
but
that was my next question. I didn't, so you don't have to be a doctor to administer the treatment?
no, yeah, especially in the state of Colorado, they're pretty loose with a lot of things. But no, you can be an esthetician, but you have to have the supervision of a physician
Oh, I see.
there. But for some people, that's pretty loose in
Yeah.
terms of how much supervision is there. So just be aware. You want
Right.
some good
Do your due
medical.
diligence when you're seeking out a place that you're going to go to.
Exactly.
That's good advice. Um, well, what else do we need to know about this, do you think? Is we've talked about how long this lasts, and it really a year to 18 months
Hmm.
is what you can expect from
Right.
this procedure.
Right, but usually we like to sell it in packages of 3. If you're a little bit older, and I won't define that because my definition of age is constantly changing. But
Hmm.
what's old? But we
40
use.
is the new 30. I know that.
I know that's right. Yeah. Um, so typically, we like to sell it in packages of doing 3 of them to get the maximum benefit.
Okay.
What you can get from a treatment. If you're really young, doing one just to stimulate a little collagen. People come in and ask me all the time, well, what should I be doing? And I just tell people, just do something. I find
Right.
that women who just do this, do that, just try
Be
different things.
proactive.
Right. And for some people, microneedling is a wow. And for some people, I've done it and it's like been underwhelming, the results, and people just respond differently. And I can't always tell you exactly why,
Hmm.
but find what your skin seems to thrive on. And so try it and see what you think. If you see some changes and you're Okay, I'll say it, over the age of probably 40, 45, probably went through a series of 3, just to get really some good collagen stimulation going. Then maybe do it once a year, then thereafter, just to kind of
Keep it
maintain
going.
going
Yeah.
and doing that, or try it.
Are there any contraindications to getting this?
For the most part, no. If if you are on like blood thinners,
Mhm.
you might bruise more.
Okay.
You have to be aware of that. If you have the tendency towards cold sores, you may want to take, they have antiviral medications that you can take so you wouldn't accidentally break out, because you never want to break out in a cold sore and have broken skin, because it
Mm.
can spread very far on your face, and that's not a good thing to have happen. Um, we always like people to be healthier. I mean, if you don't really have good health, it may not be worth your time and your money to do. But no, that's the beauty. And most of, it's really great because most of the cosmetic procedures that we do, it's very rarely I have someone that for a health reason can't do something to help themselves to look better,
Right.
which is a blessing, because sometimes when you're going through a lot of health issues and you just want to feel a little bit better, it's kind of nice to know that most things don't interact and you can do that.
Yeah,
Yeah,
it's true. And even just feeling better can have an impact on your health.
totally. And also your outward appearance. If you just feel a little bit better about yourself, it makes you look better too. So,
Yeah. Yeah. You mentioned acne scars. Is this what is the primary treatment for acne scars?
um, I think it depends on all how deep your scars are. If and Sometimes when people talk about acne scars, they're talking about discoloration. Some people have like red spots, and they
Mm.
call it an acne scar. And those typically will fade with time, but it can take years for that to
Yeah.
happen. And then some people get little superficial divots, and then
Yeah, like the pocky.
yeah.
Yeah.
And then some people get really deep, like ice pick scars. And those are the most frustrating and difficult ones sometimes to
Mhm.
treat. But even sometimes lighter, like chemical peels and that kind of thing, can help mild scars. There's a technology called intense pulse light that attacks pigment with no downtime. That can help discoloration. And then anything then that can stimulate new skin formation, like microneedling. We also use lasers that punch little holes into the skin called perfractional. Um, Lasers can help stimulate new skin growth and can really soften the appearance. Deeper peels, like what we call mid-depth. Very rare do people do really deep peels anymore because they're so high risk for scarring and also for loss of pigmentation that we don't do that much anymore.
Mm. And
Or
what's the downtime for a peel? I have heard about those.
Yeah, again, there's kind of like 3 different levels of peels. There's superficial peels, and a lot of those can have almost no downtime. Or like we do one where you have a couple days where you really peel, and so makeup isn't very functional, and you look a little funky because you got these chunks of skin. But it's not like you couldn't go out in public, you don't have to
Right.
put yourself away. But some of them you don't peel, but that doesn't mean it's not doing anything. But you can do that. And it's nice because a lot of the peels are actually developed from things like fruit acids. And so they're
Oh,
pretty natural type chemicals. But that doesn't mean that they don't have some caustic abilities.
right.
But then you have mid-depth peels. Those typically you will have redness anywhere from 3 to 7 days, depending on what peel that you do, where you can be really red and having peels and some irritation. Those are usually what we call your TCA or trichloroacetic acid peels. Then your really deep peels, or the phenol peels, aren't done too much anymore. Those you had to wear like wound care and have gauze on, and those are the
Oh
ones
my goodness.
that you don't do very much anymore. That's before we really had all the technology with lasers that we do,
Right.
that they were used. They can be beautiful, the effects and the changes, but a lot of risks associated with those, and those can be
Right.
a month of healing.
Wow.
So yeah, so
That's intense.
yeah.
So, what would you tell people that are kind of thinking, should I do this? Is this for me? and they're kind of, struggling internally a little bit about taking the time out for themselves and doing something for the way they look. What would you tell them to encourage them? Do you have a story, or, maybe probably a collage of stories, I would think, where people have just done it and just, this has just made such an impact on their life?
I don't know why as women we feel so guilty for um, wanting to do self-care and how we feel about ourselves. I think God makes beautiful things. Look at the earth around us. Every day we comb our hair and we brush our teeth and we take a little pride in our appearance. That's nothing about it. I don't want ever your self-worth or value to be in what is outward, but know that no matter how you look, that you have value, and that's not where your value comes from. But I think it's important for you to know that that self-care and taking care of yourself is, I think, what we were intended to do. We're intended to take care of nature. We're intended to take care of ourselves. And when you feel a little bit better about how you look, it reflects so many other ways in terms of you're more confident when you're relating to people. You want to engage in other things as well with self-care, whether it's exercising, eating a little bit better, all of that. When you feel better about yourself, I think the whole world benefits really from that. So first of all, don't feel bad about it. But I can't tell you how many stories of women we have that come in that were cheated on by their husbands, and suddenly they felt ugly and unworthy. And just doing a few little simple things, they weren't, they didn't look 20. They just looked a little better, and they got a renewed sense of value and worth, and that I am still pretty, and
Yeah.
I just think that it's something that it's a good gift for yourself, that actually when you build up yourself, you're building up the people around you too, by feeling better. Go to a place where it doesn't look over the top. It's not about trying to get a look, it's about just, making you just feel a little bit better about yourself. And it's amazing, just something simple like a little brighter skin tone can make you feel a little bit better about yourself. And you don't have to do necessarily a lot. Start with what you look in the mirror and hate. Go in and get a consult about it. Say, I hate this. And I'll say, I can see why you don't like that, but I want to tell you what people see. People look at your eyes. They look
Right.
there, take that look and focus, and they'll give you a different viewpoint too, of getting you to look outside of what you think is your negative aspect, which probably no one is noticing but you.
Right.
Right? And,
Right. We're
and you
so
can,
hard on ourselves.
yeah, and just do a little simple something. And some of these procedures start out under $100. You don't necessarily have to spend thousands to
Wow. That's
make
good to
yourself
know.
look better, to feel better about yourself. Um, I had a picture was in one of my textbooks about chemical peels, and there was a lady who looked like she was 60 years old and lived on the ranch for all of her life, had the most leathery skin, and she did a 70% glycolic peel, which is a fruit acid peel. Um,
Hmm.
and she did it once a month for 2 years. Totally transformed her skin. I couldn't believe the difference in how she looked doing that one procedure. Now, that's a lot of peels, I admit, in 2 years. But that peel, I think we charge $85 for. Okay.
Wow.
And it totally just changed her by just doing that one simple thing. Now, it was the thing that worked for her.
Right.
Find the thing that kind of works for you, and you can do it. So, yeah,
Well, that was beautifully put. That
yeah,
was really beautifully put. And I'm so glad that you shared it in that way, because I think that a lot of people will relate to that.
yeah, yeah.
So, where can people find you?
Well, our office name is Restoration Medical Aesthetics. We are at 5100 West 20th Street. Um,
In
and
Greeley, Colorado.
really, Colorado, yes.
Yeah.
I forget. You could be international for I know.
Yeah.
And we're located right across from the Ames campus in that area. So, yeah, it's where we're located. Our office.
And are your consultations, how much are your consultations?
With my estheticians, it's free. With me, it's $50.
Okay.
But whatever, if you do a procedure from there, 100% of that will go towards the procedure you do. So
no risk, really.
Yeah, it really isn't a big risk. We try to keep it affordable, but still just to respect the time, for doing it. We want you to take that step because, it's funny how many times people come in for a consult and don't quite take that next step. A lot of fear.
Yeah.
I was scared every time I did something new. But, we try to tell you everything that might happen, the worst case scenarios, and know that you're going to have that support when you're going through it. And most of the things we do are very simple, easy to heal, low risk, because I don't like stress. I like things low risk. So pretty safe to do.
Okay? Yeah. Well, that's great. So thank you so much for being on the Naturally Inspired podcast today, Dr. Bearden.
Thank you for inviting me. That was wonderful. Okay. Be able to share some of our story.
Yes. Thank you so much. If the Naturally Inspired movement makes sense to you, let's do this together and transform the medical model and help people take charge of their health. Learn more about how you can join the Naturally Inspired movement by going to naturallyinspiredadvocate.com or call me at 970-475-4862.